In the audience, we have seniors, we have caregivers, we have government officials, we have senior leaders of health systems. The common bond is that we're all interested in senior health. Not senior health care, but how do we maximize the health and successful aging of we're all going to be in that position. So this is just totally wonderful for us, and I want to say a number of thanks. One is thanks to our two special speakers, Todd Park and Eric Dishman, who you're going to totally enjoy. Their message is fabulous, the way they deliver it is fabulous, and I just appreciate Todd coming out from Washington and Eric coming out from Oregon to be with us. I also want to thank some special people in the audience. There are individuals in the community that have donated to make this, help make this happen. And so we really appreciate your efforts. The sister of David Drucker, the center, I'll talk a little bit about the center, is here as well. Appreciate that. And really appreciate your participation, both in the morning and for the developers in the rest of the weekend. Who I really appreciate, because this would not have happened, so we didn't hire a group to put this on. This was done by the Innovation Center team. I think most of them are standing up, but if you wouldn't mind standing up if you aren't. So these people put together this event from start to finish, in a sense, in collaboration with Health 2.0, who helped organize the developers, but really this is all because of their work, and I really appreciate that. So how many of you have been in this building before? Computer History Museum. Fabulous, fabulous. So you know that it is dedicated to the preservation and celebration of computer history. What you might not know, I certainly didn't know, is that among the things it has, software, hardware, is ephemera, whatever ephemera is. But like it sounds, it's sort of ephemeral things that exist, at least temporarily, in physical form. So in this building, there are things like this, which was invented in 1956, the first disk storage by IBM. Now, in 1956, all of that has how many megabytes? 5 megabytes. 5 megabytes. 20 years later, before I knew I wanted to become a doctor, I worked at IBM in Boca Raton, and we were going to make another thing just to put this to shame. So we made it no bigger than a bread box, and it had 60 megabytes. And so that, I mean, we don't even have words that start with M anymore. That's how old that is. But then just a few years later came this first supercomputer, which you know is a great one, and actually an example of one appears downstairs. And now, of course, that's been taken over by this, and this does even more. So things happen very quickly in this technology area, and in a sense, this is sort of legacy. So what we're trying to do this weekend and the entire program in Successful Aging is to talk about a different kind of legacy, a human legacy of the folks who made the world that we're living in now and enjoying. So we're dedicated to seniors and making sure that we support them in successful aging. So this morning, what we're going to see, I'm going to kick off by talking about our linkages program, Link Ages Across the Generations. We'll then hear from Todd Park about how his tremendous work on liberating data is going to feed into this. And then Eric Dishman has 20 years worth of experience in working with seniors, and he'll share some of his insights in that. And then we'll start talking a little bit about what's going to happen with the developers over the rest of the weekend. So let me get into linkages, which is, we're calling it an ecosystem because there's so many stakeholders and there's so many ways we can support stakeholders in this ecosystem. And I'll explain a little bit more later on. The first, so I want to get, who are we? The David Drucker Center for Health Systems Innovation. What's the problem we're trying to solve? How can we solve that by taking a holistic view of health and seniors? And what's the ecosystem we are imagining that it takes to support that? First, a word about David Drucker, after whom this center's named. He was a dermatologist, unfortunately passed away about 1.5 years ago. He'd been with the Palo Alto Medical Foundation for 35 years. The last dozen years were as its CEO. The way he described Palo Alto Medical Foundation was these three words: excellence, innovation, and caring. But as he looks at these three words, he says, well, there's a lot of excellent healthcare organizations, including medical groups in the country. There's a lot of people care. But what built Palo Alto Medical Foundation and what he wanted to distinguish us with is through innovation. And that's why we put together this innovation system. It's really a disruptive innovation system for health systems in his name about 1.5 years ago. The vision that we have is that we will no longer be just a healthcare delivery organization, not just be healthcare providers, but that we be leaders in health systems innovation that basically, in partnering with community, creates a better, healthier place to live. That's our mission. And so we've been dedicated since our founding to do just that. Blinders off in terms of how's the world now and how do we get paid? How do we make the place a better world? So we started off by asking our own organization, and over a couple days, 400 people got together actually right here. So in a sense, we were born here too. So we gathered together and tried to get the brightest ideas, the most out-of-the-box ideas from our own organization, our own staff and physicians to say, how do we make the world a better place? That, of course, involves brainstorming and storyboarding and prototype making. And eventually we selected for our first incubation project this problem, one of society's grand challenges for sure. So this represents, if you haven't guessed, the baby boomers. So if you're born between 1946 and 1964, like me, you're part of the baby boomers. Now, everybody understands why it started in 1946, the end of the war. Why did it end around 1964? When I've asked this in front of sort of healthcare managers and execs, somebody said this beginning of Medicare, which is true. It started in 1965, but I don't think it's what caused the end of the baby booms. What happened is the birth control pill was invented. So that's the defining moment for baby boomers. Now, my team also knows that I'm a lemonade person, which is, here's a grand challenge. There's got to be a way to make this a tremendous opportunity to do good. So our goal is, with this first incubation project, to take this problem and do good with it. So us baby boomers, we baby boomers arrived at the special age beginning last year. What's the special age? 65. Why? Medicare eligibility. See how much the government really influenced our lives. So we started becoming Medicare eligible in 2011, last year. When we're done arriving, we'll double in size. So 77 million people just by 2030. And that will form 1 in 5 people in the United States. Okay, what does 1 in 5 people, right now in California, we're probably about 13% in this condition. What might the world look like when it's 1 in 5? Anybody ever been to Florida? So that would be the average for the country. Now, in the trade, this is called a NORC, a naturally occurring retirement community. Now, usually it's a smaller scale, but nonetheless, this is actually a NORC, if you think about it. Now, so what's the world going to look like in that view? It's going to look a little different. Now, there's another point about this. There's 2 sexes. One is obviously more hardy and robust, and you're looking at it. All right. So AARP did a survey a couple years ago and said, what would you like the world to be like in your retirement, in your after-work years? Well, the vast majority said, I want to live at home. I want to live in the community I used to live in. 2/3 said, it's extremely or very important to me that I be close to my family and friends. And half said, I want to be close to the churches and the social organizations that I become a part of. Now, nothing in some sense is surprising about that, but it's not surprising at our subconscious level. What we need to do is make it at our conscious level if we're going to do something about it. Well, here's something that isn't so obvious. So of these factors, which one is more strongly associated with a higher likelihood of mortality and ill health? Is it living alone? Is it the number of social contacts? Is it the number of medical problems? Or is it feeling lonely? Feeling lonely. Somebody read ahead. You're exactly right. It's the perceived social isolation that is what affects your health. One point is that affects your health. And the second is that it's the perceived feeling of social isolation, more than the objective measures like living alone. In addition, this feeling lonely actually has some predictive power in terms of cognitive decline and your risk for Alzheimer, even if you control for the other things that are typically associated with that. And finally, if you have adequate social relationships, you have a 50% greater chance of survival than those who don't. Now, when you think about that, that's big stuff. We look at 13% improvement, we look at 50%, that's like stopping smoking. We just haven't raised it to our level of consciousness, and that's one of the reasons why we don't do anything about it. Now, how do you go about solving grand challenges? How do you go about forming a great company or turning a good company into a great company? Well, Jim Collins in Good to Great says it's the who before the what. You find the right who, they will figure out what the what is. And that's why I'm especially grateful and appreciative of the special team that works in the Innovation Center. I think we've found the right what to work on. So one of the things we start out doing, Monique Lambert on the team is a medical ethnographer, and she spent 2 hours with seniors and caregivers for 27 of these people in the home. That's the most important part. Not invite them in for a focus, in the home, in the natural setting. Now, they were between 70 and 90 years old, average around 80. And when she talked to caregivers, it was bimodal distribution, right? It's either your spouse or your kids. But what's going on at home? Now, what she did was bring together images, and you saw some of them before we started, and worked with part of the staff, employees of PAMF and doctors, to extract the themes from that. One of the ways we'd like to render it back for you, though, is through a video and show you some of the themes that were uncovered. Now, I want to tell you that this is ethnography, so this is based on real life and real people. That means that there's going to be situations that are going to be familiar to either you or to your loved ones. And so there may be some difficult moments here. If we can bring down some of these lights, please. Yeah, thanks.
The last year's been pretty tough on Mom. She lost Dad to a heart attack in March. None of us were prepared for it, but it was especially hard on Mom. Since then, it seems Mom's more frail. She doesn't drive anymore. It's as if she's aged 5 years in the past 6 months. Mom taught elementary school for 25 years. When Dad retired 10 years ago, Mom did too. Dad used to make planters that Mom would fill and give to her friends. She's a master gardener. Magazines used to photograph her handiwork. People at work used to come by and ask her opinion all the time. It seems like Mom's life has changed since she retired. She used to be in the center of things. Now she hardly leaves the house. Mom likes her independence, but it's as though her life is shrinking being all alone in that house. Not long after Dad passed, Mom began having her own health problems. The doctor called it congestive heart failure. Sometimes she can't catch her breath with just the slightest activity. We stop by whenever we can, but it's hard. There's nobody Mom's age on her street, and she doesn't feel safe driving anymore. Mom has said that the hardest thing about getting older is that your world dies before you do. I worry about her a lot. I've been really busy at work with tons of meetings. My husband Chris is in the final push on his company's new product, and the kids have soccer practice after school. We pick up Mom so she can watch their games, and then we try to run some of her errands. She's always complaining about being a burden. As a daughter, that just breaks my heart. Mom couldn't breathe again.
Okay, slow down.
She was gasping as she called me.
I'll be there in a minute.
What's going to happen this time? Mom was admitted to the hospital again. This was a scary one for both of us. The discharge papers have the same instructions as the last time. Make sure to take all the meds, reduce salt intake. It's not that they don't care. They're all very nice. I just keep thinking, how will this paperwork make a difference? How can we get specific advice on what we should be doing for our mom? Chris and I talked about getting some help for Mom. We need somebody who can help keep this from happening again. But who can afford that? We could try to talk her into moving into an assisted living community. But it would kill her to be without her garden. We just don't know what to do.
That represents. It opens up with a quote that came right from one of the seniors that Monique studied, and it just captures it. In fact, I shared this with a CEO of one of the senior service organizations in the community, and she didn't know of anything that captured it more concisely and more poignantly. And the reason this happens is because seniors start feeling a loss of self-worth when they leave the workforce especially. And at the same time, they don't even feel like wanting to be a burden to even their own family. And the way this scene closes is that they don't know what to do. So that's an incrimination of we as healthcare professionals. I mean, who's supposed to tell them what to do? Who's supposed to guide them? We discharge them, we send them out, but we don't tell them what to do. We don't help them what to do. So that's that's our part of the deal as well. So tons of ways we can make the world a better place. What it's also saying is basically we know about the quality of life, we know about health, we know costs, we know that more health care creates more costs, we know that poor health influences quality of life. What I don't think we were taught in med school, or what we don't raise to consciousness, is how poor quality of life affects health. So what are we going to do about it? Let's go through that circle of life to review. So we have a nuclear family, we have children. At the younger senior years, most of the people are married. Now over time, the weaker sex sort of drops out of the picture. And some of the relationships and linkages also disappear. And so by 85, only 15% of the women are married, or many are widows. What happens then is we have a little bit more, as we age, we get chronic diseases. 87% have one, 2/3 have two or more 20% have 5 chronic diseases that they're struggling with. And without more than just a care delivery system, some of the care and support comes from, obviously, the family members. In fact, a quarter of families, a lot led by the women, are responsible for at least the financial and or the social support, medical support of seniors. Now, over time, that just starts to affect the other parts of the world, which are the families. What is the impact on the caregivers? Well, since they are, in a majority of the time, 3/4 of the time, they are the sole caregiver. There's no hired help coming in. There's a lot of time spent. If the senior's not living with the family, that might be 14 hours. If you're living with the family, it could be 84 hours, which you can easily see adds up. In fact, 38% of caregivers have been doing that for over 6 years. It's a long time. There are medical risks to the caregivers from the stress and being able to keep up with multiple lives at the same time. And some of them either pull back or drop out of the workforce. There's financial implications to that as well, maybe $250,000 or $750,000. Nationwide, we're talking about a $3 trillion impact. So clearly this has a lot to do not only with the quality of life, but also the whole economic machine of the country. Our country's sort of built a little bit on a Ponzi scheme, as you know. Social Security means you got all these folks, supporting us fixed folks that are getting older. As the baby boomers come on, the ratio looks really different. Now, it's one thing to look at it from a Social Security point of view, but the picture I'm trying to paint is it's also really impactful for the quality of life and the health of seniors. Well, I'm a really optimistic guy, in addition to liking lemonade. So I know that the richest country in the world, the one with the most resources, is going to come up with a solution, especially in Silicon Valley. At least, as Winston Churchill says, once we've exhausted all of the possibilities. Now, the hard part about doing these new things, these disruptive innovations, isn't really about coming up with the ideas. It's really getting the old ones out. So what do I mean by that? Well, one, we have the lamppost problem, right? The drunk looking under the light for his keys. It's because we know how to do something, and surely the world needs what it is that we do, if we only did more of it. And that's your first reaction for anybody, including healthcare. So what if we looked at change in admission rates? So you probably know, even from the media, that for every person discharged from the hospital, a fifth of them will come back within a month, within 30 days. So that's obviously a problem. Well, we've known about this, and now the payers, namely Medicare, is going to sort of deduct from that, in the sense by the end of this year, by October, hospitals will get paid a little bit less if they come back within 30 days. So clearly it's got people's attention. Clearly we're working on it for the past 5 years, and clearly we're not really getting anywhere. Yellow is no change. Red is worse. Green is better. So how many people, well-motivated, financially motivated, smart people, we're not doing the difference. So why is that? Well, in a study released just like 6 months ago, looking at 26, people want to know, is that person coming back? Because then I know exactly what I need to do, chase after that person. So they come up with models on, can you predict who's coming back? Because that's the obvious thing. Well, it turns out they couldn't get it. Couldn't get it right. They were not accurate. Even the doctors or even the case managers couldn't pick out who's coming back, except for two. They looked at social determinants of health, like is there a caregiver, is somebody sponsoring? So this is one of those duh moments. It's very high on the duh factor, which is where you're working on something really hard and you miss the forest for the trees. The complement, though, looking at the same issue, is where brilliance can come about. Now, you find out something's a really brilliant idea after the fact when you find out how well it works. So look at Google, for example. They were really good at search because they looked at what other people found, in a sense. It was brilliant. And of course, they made a big company out of it. The other metaphor I have is man standing in front of a refrigerator. It's an incredible search problem until my wife brilliantly says it's right in front of my face. So it's the same thing as you need to figure out, get things, the issues raised to the level of consciousness so you can see what's the obvious solution. So that's sort of the technique we looked at, saying instead of being tethered to what we do and try to do more of it, let's think completely disruptive. Let's have no assumptions. Let's change the assumptions so that we can change the consequences. So let's look at how we currently connect the healthcare system. Well, we're all born with genes, and you know that more and more we figure out genes determine such and such things. And clearly that has some connection between your genetics and your health status. So what's the connection? Well, humbly speaking, of course, it's your doctor, it's your healthcare system. That's the connector. Well, if you look at this picture, it's a bit metastable. Why does this thing not teeter down right away? Well, this is why. So the Willie Sutton rule of go where, that's why you rob the banks, that's where the money is. This artificial system, it wasn't designed out of malice, it's just how we evolved, but that's what's bolstered this very metastable and quite irrational system that we have. Which is why when we're faced with this crisis of the healthcare costs, for example, reform, taking away these assumptions is just what we need to do. So instead of just relying on the clinical, the medical model of connecting what we're born with and where we end up, what if we looked at the other social determinants of health? This is what I mean by the opportunity, the grand opportunity to look at the same problem and figure out a completely different solution. And if we had that approach, what world will we build? Well, let's look at it a different way. The sort of the health pyramid. And we know that 5% of the population spends 50% of the health dollars. And so we see, what are we going to do with this? Well, let's try to push these people up to being less sick or more healthy. And of course, we have to do that. That's what we need to do. But another way to look at it is to flip this around and say, what about the 95%? So instead, there's some kind of progression going to be sicker. Can we compress that? Can we squeeze that? Can we make 95% 96%? So it's the flip side of the problem, but you got to work both ends if we're going to come up with a logical solution. So go back to the three circles. That pertains to an individual, but the individual's in a broader community. They're in the family, there may be caregivers involved, and there's the community. So how can we take advantage of all of that to support individual health and senior health? Well, one of the constructs is, so if you think about it, we were born without any money, yet we got our needs met. It's sort of a bartering system. You either look cute, or you look not so cute and say, take that. And then we get rewarded for fixing the problem. But it was all done with bartering. Then we developed this efficient system called a market economy, and we had this intermediary, and then I could get something of value to somebody, get payment, and exchange it for somebody else. And that works really well. Until you leave the workforce. If you're still under the market economy, that's where you get deprived of, stripped of, your sense of self-worth, and then the feeling of burden. What if we turn that around? Said, look, you didn't lose your talents just by leaving the workforce. You still have those talents. Is there a way to recognize it? Can you create a value economy out of this and a value exchange? Can someone trade to lift your sense of self-worth? So what if we created that kind of economy where you basically continue to recognize the value in seniors and allow this exchange to take place? So this is what we think a world like that might look like.
The last time I woke up feeling like this, I was rushed to the hospital a couple of days later. Now I have this simple device that asks me a few questions so my doctor knows how I'm doing. Things like how I feel, how hard it is to breathe. I'm connected to my entire health team. They'll even call if they need to change my prescription. I'm not left to do this all by myself. I'm not alone. What I also like is that Sarah has her life back again. I don't feel like such a burden anymore. She still picks me up for the kids' soccer games, and we still have dinner together, but she doesn't have to worry about me all the time. Ever since I joined the Linkages community, I can get a ride to go places without having to rely on Sarah all the time. The community is my life link. It's become so much more than just a ride. I was surprised to find out how many community members were interested in gardening. I never thought that I could earn rides by helping people with their gardening. Joan and I met this way. Joan was offering rides and would drive me to the doctor's office. We've turned into pretty good friends ever since. I had no idea she lived just 2 blocks away. Now we do all sorts of things together. We're headed over to Sam's house today. His arthritis was flaring up and he was having trouble keeping up with his gardening. He found me on the Linkages system. That's how I found out that he's quite the wizard with computers. I planted this rose when Jack died. He never wanted to leave me alone. But I think he'd be proud of me. I'm doing well. I still miss Jack, but being part of the Linkages community really changed things for me. It's nice to be a part of a community where I still have something to offer. The doctors say it's important to stay active and engaged, but it's not as easy as it sounds at my age. I know this sounds a bit silly, but I feel like I've gotten some of my life back. And part of it is knowing that my daughter doesn't have to give up her life to take care of me. It's funny how life changes. For almost 30 years, I worried about her. Then she worried about me. Now we can spend less time worrying and more time enjoying each other.
Do you think that kind of world is possible? Does it make sense? So why does it work? Why could it work like that? Well, one of the best ways I've heard, the best description I've heard of happiness is written by Jennifer Acker at the Stanford Graduate School of Business. She writes about happiness and 3 major components. One is meaning, connectedness, and being a part of something bigger. If you look at Act 1, that's what we stripped out. If you look at Act 2, that's what we tried to put back in. And it's sort of magic. It doesn't really cost anything. It takes effort, but there's no tax dollars involved. It's basically ways to rejuvenate life, essentially, for seniors. So if we review where we left off with the situation with the senior and the daughter's family, if we add back in this Linkages ecosystem, this platform, with other members of the community, we can create much more sense of meaning and connectedness for seniors. We can add to it community resources, whether it's Meals on Wheels or a farmer's market or transportation. We can add to it linkages to healthcare providers so that we catch things before they become bigger or more complicated. And we can even use tools, signal detectors, to figure out when we need to catch those moments. And that's a lot what we're going to do in this weekend, Developer Challenge Weekend. In the whole network, if we have a situation where a senior needs help, it can be as simple as getting the flu, for example, but that can turn into big problems. It could be not being able to go to the store and getting food. So this linkage system can alert through our human detectors ways of getting Meals on Wheels, for example, to the senior. You might need a ride either to the doctor or to the garden, and that activates a different part of the network. Or you might be gaining weight with heart failure, as our scene in Act 1 depicts. And can we step in before you end up in the emergency room or worse? That's the way we imagine this network community, essentially, as Act 2 says, to give back the life to the senior and her family. So how would we make this happen? As you can tell from the political environment, it's not as if we're going to have a whole lot more of public works making it happen. Even though, in some sense, that's what it might take. But can we make a private sector social system? We think we can. One of the models is the Apple ecosystem. So think about it. So there are tons of MP3 players before the Nano and iPod, and they don't make any music. But what they did was have a way of connecting, a rich way of connecting music to this device that they made. More importantly, they created a user experience through knowing the user profile, having these stores. And that created an entire ecosystem about enjoying music. Then they created a gadget that supports apps in a very smart way and let developers create these things. So Apple doesn't even write the apps. They just created the ecosystem that made them happen. So in a sense, Apple became the sponsor of things that allowed people to engage and help each other. So what we're trying to do is create this ecosystem for successful aging. We do think it's probably likely that a healthcare provider, like Palo Alto Medical Foundation Sutter, needs to sort of sponsor it or start it, be the community activist. So things that we want to, components that we think belong in here, one, so we're calling a senior profile. So everybody knows that you come in and you get a history and physical. Well, that's a history and physical with a medical model. That's what we think is relevant to your physical health as we knew it. What if we learn more about the things that made up of Act 2? What if we knew your interests? What if we know you didn't have transportation? What if we knew what other things you liked? And combine that with what we know about your physical health. All of a sudden, I have a different picture of you. So when we want to create a micro community, knowing that, we can help match people who have similar interests in the similar geography and start combating social isolation, start creating social networks of the humankind. And when we want to match you with resources that you may need, we may not say, here's just another social service, here's a home health program, but we may know special things about you, your medical condition, but also your social condition, and tailor match things in this quadrant with what you need. So instead of just having activities of daily living, sort of subsistence, being alive, what if we created activities of meaningful life and supported that instead? Now also, that we need to have sort of a continuous sort of watch and surveillance to pick up the finer points, the good points, and the points in need. And that's what we mean by signal detection, the subject of this weekend in terms of developer challenge. So everyone recognizes that blood pressure and scale and glucometers, those can all be turned into electronic form and transmitted and rendered back. What we didn't consider as much, I don't think, are the human signal detectors. So it could be the postman, it could be the Meals on Wheels driver, it could be your neighbor. There's a lot of other rich signals that just go off into ether. Can we harness those? Can we tap it? Can we combine it with what we know from the senior profile, what we know from your health record, what we know about resources, and basically support much more robust, much more meaningful living? That's the ecosystem we're imagining for successful aging. We call it linkages, link across the ages, across generations. And we think it's a combination of all these things that are required in order to put this together, a bit like the Apple ecosystem. we're working on all these components today, now. What we want to work on this weekend is with your help. The ingenuity, the creativity of Silicon Valley is with the signal detection and not just the physiologic signals. So in short, what I tried to do is talk about this grand challenge to society, but really talk about it in the context of it being an enormous opportunity to just sort of transform what we do with a different part of our life, which all of us are going to face. That it is, we have to apply disruptive thinking, not just more of what we do in order to get there. A big part of that means changing the business model, and that's the Xing out the current drivers of fee-for-service, for example. That we want to reinvent, we want to redefine our role as a healthcare provider, a traditional healthcare provider, into one that doesn't ignore that, but that is a partner with communities. So not only with individuals, but entire communities to create an ecosystem that advances health. So we really think it takes a village to do this, and that it's by and for the community, and we're asking you to be a part of that. Now, I was at TEDMed just earlier this week, or yesterday, and it was held at the Kennedy Center this year. And of course, John F. Kennedy set a goal for the country of going to the moon within 10 days. 10 years. So in some sense, that was certainly a BHAG, big, hairy, audacious goal then. What we're proposing is truly a BHAG. But they're different in ways too. So every night, you can go out there and you can see the moon. You know what the goal is. And there's a fixed number of people that can get us there. And they used to work at NASA. And there are a fixed number of rules or laws that they had to worry about. And they're written by Newton. That's different from the problem we're describing. The goal is not so concrete in there every night and is easily visible. In fact, you know, the Act 1 scenario we described, so many people in this room know about that. But we're all suffering in silos. We all assume that it can't change. And so it truly is an invisible problem, unlike reaching the moon. The second piece is the fixed number, NASA going to the moon. Well, this takes a community, everyone, like in this room and beyond, to get us there. But the one thing I will say is that when we get there, just like the moonshot, it'll be tremendous looking back and seeing what we've accomplished when we get there. So what we're asking for, thank you for attending this event. Thank you for participating. Thank you for your thoughts. And we really welcome the entire community to join with us to be a part of the change that we want to make. With that, I thank you so much for your attention.